Now, this week, the Department of Health is sounding the alarm over a potentially deadly disease frequently overlooked yet easily preventable. Now, according to the World Health Organization, rheumatic fever and rheumatic heart disease claim more than 200,000 lives globally each year. The alarming truth is that the untreated strep throat can lead to rheumatic heart disease, which is a life-threatening condition that can cause heart failure or even stroke. Now, joining us this morning is Ernst van Rensburg, who's a clinic admin manager at Dis-Chem and professional nurse, to talk to us about the dangers of rheumatic fever and, of course, the importance of early detection and treatment. Ernst, thanks so much for your time. Welcome to Morning Live.
Good morning, Sakina. Thank you for having me.
Let's start by perhaps just delving into exactly what rheumatic fever and rheumatic heart disease is and how our viewers can go about perhaps detecting some of the symptoms.
Rheumatic fever is an inflammatory condition that is caused by a previously untreated streptococcus infection. Now, a streptococcus infection is a strep throat infection or scarlet fever infection. So it's primarily those two conditions that children between the ages of 5 and 15, primarily we see it develop in children from that age. And if children in that age develop either scarlet fever or a streptococcus throat infection and it's untreated, then the disease may result in rheumatic fever, which then ultimately later in life may also cause rheumatic heart disease.
So in terms of, any symptoms specifically that people can look out for, Ernst, of course, as you say, in the throat, but is there anything else that people can look out for?
So the really important thing, and this is really what sets this aside from a normal throat infection. So if a child develops a throat infection, the symptoms are typically quite sudden and it's extremely painful. It goes with a very high fever and swelling in the neck. Then it's really important that you get your child to a doctor or nurse as soon as possible. If a child is then treated with antibiotics, it really decreases the risk of developing rheumatic fever. But ultimately, if it's not treated, then we become worried that it may result in rheumatic fever. So after a child had the throat infections from a streptococcus infection, it usually takes about 1 to 5 weeks after that throat infection for a child to potentially develop rheumatic fever, which starts with also very high fever, it's tenderness of the joints, a child can have swelling in the brain, and it can be quite serious. That's why it's really important to treat that initial throat infection and to stop this from ultimately becoming a rheumatic fever disease.
So why is it that it is often misattributed to other illnesses as opposed to immediately diagnosing rheumatic fever, for example?
Rheumatic fever symptoms start off as quite vague. If a healthcare professional doesn't take a good history from a patient, for example, if a patient presents to a doctor's practice or a nurse's practice and they have joint pain suddenly and they have mobility issues and the onset of that, the start of it is quite sudden. And if you don't take a history of the patient to ask, did you perhaps have a throat infection in the last couple of weeks, you might not put those two things together. So patients are often misdiagnosed and treatment of rheumatic fever is then delayed. So the treatment of rheumatic fever primarily focuses on targeting or preventing rather the inflammation and the fever. So if the inflammation and the fever is, if both of those are treated and kept under control, it really also limits the possibility of a patient developing rheumatic heart disease later in life, because heart disease often comes from an untreated, uncontrolled fever. So if those symptoms are identified by your healthcare professional and it is treated, it really prevents that from escalating to rheumatic heart disease later.
Now, the World Health Organization, Ernst, reports that rheumatic fever claims more than 200,000 lives globally annually. So what is the situation like in South Africa, and is it of significant concern here for us as well?
It's absolutely of significant concern. It's all about awareness. So there are two main reasons why we are really worried about rheumatic fever, in the sense that there are two pillars that we almost have to target. The one is awareness. We need to create awareness around this, that if a child or an adult has a sudden throat infection, have it treated as soon as possible. Don't just attribute it to tonsillitis or something like that. Rather have it checked out and have it treated. That's the first and most important thing. The second thing that we need to focus on is access to healthcare. Many times patients might have this severe throat infection that started suddenly, and they might even identify the symptoms, but it's not treated because the patient might not have access to healthcare. So it's all about having access to a doctor, having access to a nurse, and knowing who in your community you can approach, whether it's a government clinic, whether it's a private clinic, whether it's a private doctor. It all depends on what you have access to. But it's about having a relationship with your healthcare provider so that you know who to go to when you need that healthcare. So it's awareness and access to healthcare.
So for those people then, Ernst, who've already been diagnosed with rheumatic fever, how important is it for them to actually adhere to the prescribed treatment plan? And how is this likely to affect their long-term health, either way, whether they comply or not?
So it's really important to understand for patients that have been diagnosed with rheumatic fever, whether recently or whether a few years ago, is that you need to adhere to treatment. If you have flare-ups within your disease progression, for example, if you have a fever, if you ever have another infection that might cause a fever, it's absolutely important that you keep that fever under control. But even more important is that for the rest of your life, you will need to make healthcare professionals aware that you had a rheumatic fever, perhaps as a child or as a young adult, so that if any cardiac symptoms, so if you, for example, start having chest pains or severe fatigue, that your healthcare professional will know that you had rheumatic fever, so that they can refer you for possibly a heart sonar or something in those lines, to see if the rheumatic fever you had as a child is not causing rheumatic heart disease currently in your life.
And then that, of course, is very important because, unless perhaps someone is told about this, that they have to inform their medical practitioners subsequent to having this, that they have had it at some point. People, if they don't know, will just not mention it, and who knows what the consequences might be. But what would you say, Ernst, is the key takeaway that you would like to leave our viewers with in terms of how they can take action, firstly, to protect themselves and their families from rheumatic fever and rheumatic heart disease?
Very important. If your child or one of your children's friends or anyone in the school that you might know of, unfortunately, you might not always know, but if there's anyone that has a sudden severe throat infection, it's important that you take antibiotics as soon as possible. At least take your child to a doctor or to a clinic that they can have a look. If it's something that does not require antibiotics, then we know at least. But if it's something that does require antibiotics, very important. It's also important for teachers that they know that if a child in their class or in the school has a strep throat infection, that they alert parents around them as necessary to take precautionary antibiotics if necessary. But for parents, if there is a sudden throat infection, please take your child to a doctor or to a nurse so that we can have a look and treat it if necessary.
Is it possible for it to go undiagnosed, though, Ernst? Because, we spoke about maybe being misdiagnosed, but could it possibly go undiagnosed at any point?
Absolutely, yes. It can definitely go undiagnosed. If a patient, for example, it's definitely something that I've also seen in practice many times. Patients might not have access to healthcare. So most throat infections, regardless of how severe it is, many throat infections will eventually heal on its own. And then if a patient doesn't have access to healthcare, then they might have to wait for that infection to heal on its own. And not all streptococcus throat infections will cause severe illness that will definitely result in a patient having to be admitted, for example. So if a patient is at home, they don't have access to healthcare, they have a strep throat infection, it heals on its own, then that will absolutely go undiagnosed. A few weeks later, the child starts experiencing rheumatic fever symptoms. And again, access to healthcare is an issue. So the patient will again go undiagnosed without a diagnosis and treatment. So it is definitely possible.
Well, I must say that's been eye-opening for me this morning, just in terms of things that we may take lightly that could actually be quite serious. But Ernst, thanks so much for your time. And that's all the time we have this morning discussing rheumatic fever and rheumatic heart disease. A stark reminder there from Ernst that untreated strep throat can actually lead to potentially fatal heart conditions. Ernst van Rensburg is the clinic admin manager at Dis-Chem and also a professional nurse. So there's something that we need to take to heart.